Of this occasion, the chairman of the opening ceremony, Professor Oluwatosin Odunayo, the Honorable Commissioner for Health, Nasarawa State, Dr. Gomna, the President, CMDA, Dr. Kaide Iyun, Chairman of CMDA Nigeria Global Network, Dr. Chila, Reverend Dr. Michael Olusegun, the Primate of the Church of Nigeria, former President, members of the Board of Trustees, the Governing Council, Executive Council of CMDA, organizers of the 6th CMDA Conference, principal officers of the university, deans, provosts, HODs, staff, and students, our esteemed guests and our esteemed participants, members of the press, ladies and gentlemen. On behalf of the Board of Trustees, the Governing Council, and principal officers, staff and students, and members of the university community, I welcome you to Bingham University. Bingham University is a private, actually the first private university in the northern part, established in 2005 by the Evangelical Church Winning All. So we're barely 19 years old, and next year we'll be celebrating our 20th anniversary. Over the past 19 years, we have 40 undergraduate programs, 40 postgraduate programs. We have a College of Medicine and a teaching hospital. Some of our members are here, students. And then 15 faculties. So the university over the last 19 years has grown in leaps and bounds. So we are very pleased to host the 6th joint conference, which is estimated to bring together about 2,000 medical doctors, dentists, students from 36 states of the country, the FCT, and across the world. And I feel highly honored to be the special guest and the the guest of honor for this conference. Let me appreciate the leadership of CMDA for your support and assistance while preparing for this conference. We do not also take that for granted. I've been asked to share briefly on collaborating for greater impact. Collaborating for greater impact. And all I'll be doing within the 20-25 minutes that I have is to share some tips with us and draw lessons from the book of Nehemiah. And since this gathering is a gathering of medical doctors and dentists, and your desire is to impact, to share, to serve, and to shine, I think the good place for me to start is to compare the model of the early missionaries and our current model. First, the early missionaries came to Africa. They understood the power of collaboration for greater impact. So what did they do? They formed associations and partnership groups in the United States of America, in UK, in Canada, and other parts of the world. They also mobilized internal resources and experts across different fields, whether it's health, agriculture, politics, economy, missions, and the rest of it. So while they were on the African continent, they formed alliances and worked together. That's why you have the Sudan Interior Mission, the Sudan United Mission, the Anglican, the Presbyterian, the Lutheran. So they formed alliances and worked together. And so what is intriguing to me, those of you who are aspiring to go to heaven, you go to some of these countries and they actually look like heaven. All right? So for somebody to leave that environment and sacrifice their lives to come to the jungles of Africa to help poor, illiterate, and diseased communities, That was a huge sacrifice on their part. So today, what is our model? Today, rather than learn the lessons from the early missionaries' model, now we work in silos. Rather than collaborate, we are competing. And each person wants to have his own clinic, each doctor wants to have his own hospital. But we thank God for CMDA. Can you clap for yourselves? Yes, so CMDA gives you the platform for collaboration. Now, the other irony, or what I would call paradox, is that after being trained in the cities, few of us, will want to stay in rural areas. Many of us came from rural areas to the cities to be trained. Once you are trained, you don't want to go back to the rural communities. And even those working in public hospitals in the cities are abandoning the government hospitals to set up their own private hospitals. And while the Western world have virtually conquered their diseases, we are left with what is called neglected tropical diseases. I wonder who neglected them. Is it the whites? Is it the Western world, or we seated here? They have conquered all their most of their diseases, and they called ours neglected tropical diseases. I think we need to think about that. And while these missionaries from the West left their conducive environment to the jungles of Africa to help poor, needy, illiterate, diseased communities, we, after getting all the training, are leaving our rural communities and urban communities helpless by running to the same Western world that came to the jungles of Africa through what the primates say, the Jackpot syndrome. That, to me, is a paradox. So the question is, who will help the jungles of Africa if we all disappear? So Nehemiah teaches us a good strategy. Nehemiah was a while you can say a physician in the king's palace in Babylon. Because to be a cupbearer, it means the well-being and the welfare of the king is actually in your hands. And so he teaches us that you can be in diaspora and still be of help to your community. And this is precisely what CMDA Global Network is doing. So I like that model. I think they probably took it from the book of Nehemiah. So the first lesson that Nehemiah teaches us that you need to have a clear vision, a clear understanding of the challenge and the predicament of your people. If you read Nehemiah chapter 1, verse 1 to 3, he asked Hanani and the men about the Jewish remnant, that is about the people. He also asked about the land. And he was told that the people were in great distress, they were disgraced, and all the families were in trouble. The wall of Jerusalem and the gates have been burned down with fire. So if CMDA wants to make impact in our society, then you need to understand the people, and you also need to understand their land. And those can be summed into two. So because all the diseases could be a factor of habits and habitats. Habits talk about the people. Habitats talk about their land and where they stay. So you need to ask yourself some good questions, and you need to have a good understanding of the people you're trying to help. You need to also understand their habitats and where they stay. And that will mean CMDA is not just about gathering like this. CMDA will be, you need to have the research wing. So before you move to any community, you have people who are giving you information about the people, their lifestyle, what they eat, and their belief system, their mindset, and all of that. The research team will also give you information about their land, about their water, about the soil, the economic activities in those places, the vegetation, the weather, the climate, and all of this. Because habits and habitats are risk factors and can predispose each community to different diseases. And anything that will affect the body will affect the soul and the spirit. Now, you want to deal with the total man, you need to understand the people and the environment. The second tips or lesson from the book of Nehemiah is that you need to go to God for direction on how to collaborate and to make an impact. Nehemiah chapter 1, verse 4 to 10. Verse 4 says, "When I heard these things, I sat down and wept. For some days I mourned and fasted and prayed before the God of heaven." So you are not permitted to just rush to any community to offer medical help if you have not gone to the great physician. You need to get back to the great physician. You need to sit down, and sit down helps you to reflect, to meditate. Sitting down helps you to empathize with the people. So Nehemiah sat down, he wept, he mourned, he fasted, and cried to God. So the point is, no matter how disturbed you are about the predicament of the people in the communities you want to serve, you are not permitted to go there until you have met the greatest physician. And you need to understand the power of collaborative prayers. Nehemiah knew that he couldn't do that alone. So he prayed in verse 11 of chapter 1, "O Lord, let your ear be attentive to the prayer of this your servant, and to the prayer of the servants who delight in revering your name." So he knew that this was a battle that he alone couldn't fight, and he needed collaboration. He needed the prayers of other people. He needed to collaborate with others. So you need to remember that you are not alone. There are other doctors who may not even be seated here this morning, but they are there fighting and collaborating with you. The third lesson from the book of Nehemiah is that you need to see the people as God sees them. Because when you get to him as the great physician, he tells you the condition of the people. He's able to give you discernment. He helps you to discern the condition. In verse 10 of chapter 1, Nehemiah said, "They are your servants and your people, whom you redeemed by your great strength and your mighty hand." Although they are now in a deplorable condition and seemingly hopeless situation, but they are still God's people. These people that were abandoned in the rural people, they are also people bought by the precious blood of Jesus. Jesus died for them. The ones we are neglecting in slums because we don't want to go there, they are also precious in the sight of God. So it is not just up or up there when you leave and disappear. So if you have the knowledge and understanding of the God that you serve, the fact that he has bought all of us with the precious blood, you will not reject rural posting. How many of us will want to go to the rural areas after this message? All right. The fourth lesson is that you must know that the medical profession, we've been told, is a noble profession, but it also is a wonderful and a rare platform given to you by God, individually and collectively. Verse 11 of Nehemiah 1 says, Nehemiah realized, he says, "And I was a cupbearer to the king." Cupbearer means I have a wonderful platform. I determine the welfare. If I want the king to die in the next second, he will die. I determine his well-being. Whatever food that will be served, I determine that. So he said, "And I was the cupbearer to the king." So he knew the power of deploring the platform that he had. The problem with many of us Christian doctors is that the higher we go in life, the intensity of our light gets dimmer and dimmer. So if they make you the physician to the president, for instance, rather than show him that you are the light and you are the salt, now you want to pretend that you are not a Christian. So I was very happy when the commissioner of my state, Dr. Gomana, said anywhere he's very proud to be a Christian. Thank you very much, sir. Those are the Nehemiahs of our days. Some of you in the south, in the east will say, well, if you see him, you will say he's Omogambari, isn't it? But that is somebody who is not ashamed to be identified with Christ. So many of you are either physicians to governors, to senators, to presidents. Some of you seated here are all. So you need to recognize that that is a rare platform that God has given you as a physician. You are the cupbearer. So I want to challenge you to look inward and to ask the question, where is the current place of your assignment? Are you serving a commissioner as a physician? Are you the physician to the chairman of your local government or the governor of your state? Just see yourself as Nehemiah. And so you'll be shocked to realize that as Nehemiah, you have a lot to do. People will talk about the governor anywhere he goes, but you know the condition, you know the crisis he's facing health-wise. And so you can go to the greatest physician and say, oh Lord, please heal the king. 5, you need to leverage the opportunities available to you. If you read the whole of chapter 2, Nehemiah mobilized resources. He used that platform and said, oh king, I need to go fix the problem in my rural community, in my community. And he said, give me letters. Letters to the kings of Euphrates, to the governor of that, to the president, to that minister. You can imagine a doctor asking the king, give me letters. And collaboration is not just about us seated here. Collaboration means that as a doctor, you can walk into any community. You can walk to believers' offices and unbelievers alike. Nehemiah got letters because he knew out of these people that he needed to fix his problem, he needed masons, he needed carpenters, he needed visa, even to be able to pass. He needed all sorts of resources. And he used the platform that he had. Nehemiah understood the timing, the time to act. He understood he needed destiny helpers. And destiny helpers in your way of making impact may not necessarily be in church. There may be some unbelievers out there, but because you are coming as a doctor, they give you access. You treat his child or treat his daughter, and then he says, oh, fine, take that land, it's yours. Then you can say, well, we'll put up a church there. So you need to understand the power of elevator prayer. Each time I come to the office, that 2 seconds, I climb with a security person in the university. And that 2 seconds is enough. Nehemiah said, I just looked up to God and I told him. So just that split second he had with the king made a whole lot of difference. And he understood the power of volunteering to do the work. He knew about the deplorable condition, and he also knew it wasn't something he was going to do alone. So he needed to mobilize people, mobilize the right team, and mobilize the right resources. And he also understood, if you read the book of Nehemiah, he understood there are vision killers. So if you want to collaborate, you also need to have the discernment that there could be people who will want to kill this vision. And so how do you do, like Nehemiah, you know how to address them. You are walking with one hand and with your sword in another hand. And so he also understood the power of research, what we call reconnaissance survey. He sent people, he went to Jerusalem, took a tour just to see. He didn't tell anybody what he was coming to do. So sometimes these are our big banners. So person is hitting town, is storming town. You announce yourself too soon. So he went quietly at night, just went around, inspected to see whether he was told was correct. And then he understood the power of information management. 6, you need to share the vision of what the future will look like. And so after he went around, did the reconnaissance survey, then in verse 17 of chapter 2, he said, then I said to them, you see the trouble we are in? Jerusalem lies in ruins and its gate had been burned with fire. This is like those of you in diaspora mobilizing yourself and saying, do you see the trouble we see in Africa? Do you see the deplorable condition? Do you see even how they tag our diseases, neglected tropical diseases? What can we do to address that? Who neglected those tropical diseases? So those of you in Global Network, you will need to have the mindset of Nehemiah so that you can share the vision with like-minded doctors and physicians out there so that you can paint the picture of how the condition of our communities look like, paint the picture of how success for the African jungle will look like if everybody is healthy. All the things that we see in the media are people who are malnourished, who are diseased, who are poor, who are helpless, and all they require is drugs, medication, everything from the Western world. What can we do to change the narrative? You also need to have the right people and delegate responsibilities. So the whole of chapter 3 and chapter 3 of Nehemiah, you will see this person built this, next was done by this, next there are people who simply fixed a door. There were people who connected a whole fence. There were people who did all sorts of things. So Nehemiah mobilized all of them, goldsmiths, perfume makers, carpenters, men, women, sons, daughters. Nobody was left behind. All of them were part. So he understood the power of collaboration for impact. So he mobilized the right people, people that feared God, people that were dependable, people that were prudent in the management of resources, people that were tested and trusted. And we could see the result. So read chapter 3 of the book of Nehemiah. And there are so many lessons, time will not allow us, lessons about effective communication, lessons on how to manage expectations, because people will come to this group with different expectations. Lesson on how to take advantage of your comparative, leverage your comparative advantage for impact. Respect diversities, so you can't make it alone just because you are from the north. You can't make it alone just because you are from the east. So this gathering, CMDA, provides a very good platform for us to leverage the diversities that we have. And then learn to celebrate milestones. You have come a long way. 50 years is a long way. What have been the milestones that you have achieved over these 50 years? Now, do you have a strategic plan for the next 50 years? What can we do? So you learn to celebrate those milestones. And you must learn to collaborate. You are not competing. Philippians 2:25, Paul was describing Epaphroditus as my brother, my fellow worker, and my fellow soldier. So we all must see ourselves as brothers and sisters, and then as co-workers, as fellow soldiers, because we have the same, we're facing the same enemy. As I try to draw conclusions, we need to understand the 7 gateways. Our primate talked about the 7 spirits of God. But we also need to understand the 7 gateways. These are like entry points if you want to take over, if you want to make impact. 1 is the family front. 2nd is the religious front. The family front is the core of society. That's where we train our children. That's where we impact godliness in them. The religious point is where we gather like this as Christians. Now, the trouble is, for us to take just the 2 gateways. Now you are training your family, training your children in the way of the Lord. But you are not just training them to remain in the house. You take them to church. You are not just training them to move from your house to the church. Now, today's church, our strategy is slightly faulty because we're excited about just training our children in godly ways, and then we take them to church, we drive them back, and we are satisfied. And yet we forget that other gates are very critical to their survival at home and in the church. Take one policy, one government policy, just an announcement that fuel subsidy is gone has changed everything, including the offering that we get in church and tithes. Yes. So you must pay attention to the other gateways. And so education is the 3rd gateway. where you find the child you train today, after getting the degree, he tells you, you are no longer my daddy. He has found another daddy elsewhere. He respects his teachers more than you. So if you don't train him to have that diversity mindset, then you create a problem for him. He gets to school and he's taught about evolution and is completely confused. The other gateway is the media, and that is one area. If we want to collaborate, we must also pay attention. We can leverage media for our own good, but we must also realize that it can be a negative entry point into your house, into your home. You will have trained your child very well. You are taking him to church. You have bulletproof gates and doors, CCTV everywhere, but you don't know what your child is doing with that cell phone in his room after the closing prayer or evening prayer. He doesn't need visa. There are people distorting his mindset. They don't need visa. They don't need to knock at your door. You have all the security men, but people are reaching out and distorting the minds of your child, of your children, just by the handset you bought for him. He's exposed to all kinds of porn pictures. He's exposed to all sorts of things. And then suddenly one day, he wakes up and tells you, I'm no more going to church. And you're wondering, with all the prayers, with all the things you did, what has happened? An enemy has infiltrated your home without you knowing. So we need to pay attention to that gate. The art world, we see our doctors, which is supposed to be a noble profession. Those days as a little boy, once you come and they say you have headache, and you see that doctor with his white lab coat, he touches you on the head, your sickness is gone without even any treatment. Now today, you find the same doctor, you come to him, he has Bob Marley. He has not combed his hair for 30 days. And they tell you that is a medical doctor to treat your condition. You know that you will go back with worse sickness. So we need to pay attention to, these are the models to a lot of them seated here today. The other one is the business world. We are living in a very depressed economy. If we don't pay attention to, so that means if we identify all of these gateways, doctors, you have a platform to be in the educational gateway, in the media, you have the platform to reach out to all of these gateways. And then government. So we shouldn't leave politics to only the politicians. We are saying if you want to make impact, you have to penetrate all these gateways. And if we do not have Christians who are truly lights in all these gateways, after training your child and they're exposed to the other 5 gateways, the church will become worse off. So the last point is for CMDA to go back to the drawing board after spending 50 years, revisit your vision and your mission. You want to make the total man. You want to establish Christian witness through medical and dental doctors in every community. This is what you have in your mission statement. So I underline every community in Nigeria. The question is, how many communities do we have in Nigeria? And beyond. Local governments alone, we have 774. How many of you are in all the 774? Is CMDA in all the 774? That is what you have set out in your vision. You have core mandates to strengthen medical and dental association chapters nationally. How far have you done that? To establish and enhance Christian witness through members, personal and corporate ministry in a holistic manner. So you need to reflect how many Christian doctors are in CMDA and how many Christian doctors are not there. How do we get those ones in? How many more can we reach to join CMDA? What is the ratio of medical doctors and dentists to the 774 local governments that we have? These are strategic questions that we need to ask. And what is the extent of the coverage of CMDA in the 774 local governments? How many local governments have we penetrated so far? How many communities are yet to be covered? Do we have key performance indicators for achieving our vision and our mission for the next 50 years. What time frame do we have? The next 5 years, what can we do? Those are the global network. Over the next 5 years, what can you do for the jungles of Africa? And what strategies are we putting in place so that the next 20, 50 years, we will be able to address this? So my prayer for CMDA is that we will live up to the vision, the mission, the core mandates of CMDA. You have a very unique opportunity as an association to revisit your vision and mission, to reflect on how you have fared so far in achieving those strategic vision and mission. You have a unique opportunity to rethink your strategies for greater impact. An opportunity to renew your commitment to God, who is the greatest physician. An opportunity to remain focused, steadfast, unmovable until you achieve your set goals. May the Lord bless you in Jesus' name.